All right, so you're gearing up for those plastic surgery boards, and we know lasers for facial rejuvenation, that's a topic that can make or break you.
Oh, absolutely. It's a must-know.
So we're diving deep, deep into those high-yield concepts, the stuff that'll help you nail those tricky exam questions.
We're going to cover it all. Ablative lasers, non-ablative lasers, how they work, what to watch out for. You'll be ready.
Perfect.
You know.
Let's jump right in. Starting with the basics. Lasers, they generate heat, right? And that heat, we can use it, control it precisely to target, zap specific tissues.
The key here is that idea of selective tissue injury. Lasers are tuned. They're designed to target specific things in the skin, things we call chromophores. The big ones, the ones they'll grill you on, are hemoglobin, oxyhemoglobin. Those are for vascular lesions. Melanin, that's for pigmentation. And then, of course, water. Water's everywhere in the skin.
It's like picking the right tool from your toolbox, depending on what you want to fix. And that exposure time, it's got to be shorter than the thermal relaxation time, right, of whatever tissue we're targeting.
Exactly. Got to protect that surrounding skin. Can't have any collateral damage.
All right, so let's talk ablative lasers. These are the ones that actually vaporize those superficial tissues. And then deeper down, they coagulate things, stimulate collagen remodeling. That's where we get that skin tightening effect.
Think of it like a controlled injury, a little bit of damage that kickstarts the skin's healing response, and boom, you get that youthful look.
So the two main types of ablative lasers that we use are the CO2 laser and then the erbium, YAG laser. Let's start with the CO2 laser, the one that's been around forever. It's like the workhorse, the classic for facial rejuvenation. What are the must-know details about this laser?
CO2 laser emits light at 10,600 nanometers. Its main target, water, like we talked about. And the depth of that ablation, how much we vaporize, that can depend on a bunch of things. How many passes we do, how long we let the tissue cool down between those passes.
Okay, so that cooling time, that's crucial. What happens if we don't give the tissue enough time to cool down?
Not enough cooling, well, you'll get less ablation, less vaporization, and more thermal damage. More damage equals higher risk of complications. Nobody wants that.
Right. So how do we know clinically when we've reached that right depth with this CO2 laser? What are we looking for?
The skin, it'll turn this pale yellow color. That's how you know you've reached the midreticular dermis. Reepithelialization, that's when the new skin cells come in. Takes about 8.5 days on average.
And that's when we see that nice improvement in the papillary dermis.
Yeah, you get this reorganization of the collagen, nice tight bundles, smoother appearance.
Okay, side effects. We got to talk side effects. What are the big ones for CO2 laser resurfacing?
Erythema, that's redness, can stick around for a while, 3 to 6 months. Hypopigmentation, lightening of the skin, that's a worry, especially in those fair-skinned patients.
So treating the whole face rather than just little spots helps avoid those obvious lines.
Yeah, no one wants a two-toned face. And remember, that hypopigmentation, it can pop up even a year or two later. So, gotta warn patients about that.
What are some other side effects we should be thinking about?
Hyperpigmentation, the opposite of hypopigmentation. Melia formation, those little white bumps. Acne can get worse. Allergies, infections, herpes flare-ups, even hypertrophic scarring and ectropion, that's where the eyelid turns outward.
That's a pretty long list. Are there any absolute no-nos, contraindications for CO2 laser resurfacing?
Active infection, any kind, viral, bacterial, fungal, nope. And if they've been on isotretinoin, Accutane, within the last 6 to 12 months, can't do it. Too risky.
Got it. Now let's talk about the fractionated CO2 laser. How is this different from the traditional CO2?
Fractionated, it's all about precision. It delivers the energy in this tiny pattern, almost like pixels, creates these microthermal zones, MTZs, surrounded by healthy tissue, heals faster, less downtime.
Sounds like a win-win.
Exactly. And you can do multiple treatments, cover bigger areas without worrying about messing up the pigment, so it's good for a wider range of skin tones.
All right, on to the erbium, YAG laser. How does this one stack up against the CO2 laser?
Erbium, YAG, wavelength of 2,940 nanometers. Targets water, just like the CO2, but it absorbs energy way better, like 12 to 18 times better.
So more efficient. Clinically, what does that mean?
Less heat spreading to the surrounding tissues. And the tissue, it gets ejected as the laser hits it, which can make the results more consistent.
Interesting. What about depth? How deep does it penetrate, and how much thermal damage does it cause?
Each pass, you get about 3 to 5 micrometers of ablation and around 20 to 50 micrometers of thermal damage.
Okay, and how do we know when we've gone deep enough with the erbium, YAG?
You'll see pinpoint bleeding, and the dermis will look fragmented.
And what about collagen stimulation? Do you compare to the CO2 laser?
Good question. It doesn't stimulate collagen remodeling the same way the CO2 does, so not as good for tightening.
More superficial then. What's it best for?
Epidermal lesions, dermal lesions, acne scars that are a bit atrophic, mild sun damage, subtle pigmentation problems.
And recovery time. Quicker than CO2.
Much quicker. Reepithelialization in about 5.5 days, and the redness usually gone in 3 to 4 weeks.
So less downtime, definitely a plus. Side effects. Similar to CO2.
Generally fewer side effects. You might see some temporary hyperpigmentation in about 3 to 24% of cases, and hypopigmentation in up to 12%.
Before we move on to non-ablative lasers, can you talk about combining these resurfacing procedures with a rhytidectomy?
You can do CO2 and erbium, YAG resurfacing at the same time as a facelift, but you have to be careful. It's a double whammy for the skin.
Good point. All right, let's talk non-ablative lasers. These are the ones that rejuvenate without actually breaking the skin's surface. How do they work their magic?
Non-ablative lasers, they work by heating up the dermis, the deeper layer of the skin. That heat causes inflammation, gets the collagen to reorganize itself, and even stimulates new collagen production.
So it's a gentler approach, but still effective for getting that collagen boost.
Exactly. You won't get those dramatic results like with ablative lasers, but for patients who want improvement with minimal downtime, non-ablative is a great option.
And they can help with dyschromia too, right?
Absolutely. Pigmentation problems, they respond well to non-ablative lasers.
Perfect. Let's get specific. First up, fractional resurfacing. How does this technique work?
Fractional resurfacing uses a laser with a 1.5 micrometer wavelength. Penetrates about 300 micrometers into the skin. We apply blue dye in a specific pattern, and that dye acts as the target for the laser.
So we're really targeting those little areas. What are the advantages of this fractional approach?
It creates those microscopic thermal zones, MTZs. Remember, the surrounding skin is left untouched, so it heals faster, less downtime compared to ablative lasers.
And how many treatments do patients typically need?
Usually a series of 4 or 5 treatments, about a week apart.
Okay, so it's a more gradual process.
Yes, but minimal downtime, only about 24 hours.
All right, let's talk ND.YAG laser. What do residents need to know about this one?
NDYAG stands for neodymium.yttrium-aluminum-garnet. Big word, I know. Emits light at 10,064 nanometers. And it doesn't target a specific chromophore. It's what we call nonspecific energy absorption.
So what does it actually target then?
It seems to primarily target different proteins in the skin, like those found in blood vessels, red blood cells, collagen, and melanin. Water is a secondary target.
And because it's nonspecific, what happens?
You get this general heating of the tissue, the laser energy scatters, and the area with the most energy density ends up being 1 to 2 millimeters below the skin's surface.
So it bypasses the top layer and gets right to where we want it for that collagen stimulation.
Exactly. And another, plus it's safe for all skin types, all Fitzpatrick skin types.
That's huge. So what's happening at the cellular level when that laser energy hits the dermis?
Photo damage, basically. Controlled damage and inflammation. That triggers the collagen to reorganize and new collagen to form. Leads to a mild tightening effect.
So no crusting, no swelling, no prolonged redness like we see with the ablative lasers.
That's right. The collagen changes might be less dramatic than with ablative lasers, but you get a much gentler treatment, much less downtime.
Now, you mentioned a 1320 nanometer version of the ND.YAG laser. What's different about that one?
The 1320, it's designed specifically for non-ablative facial rejuvenation, its main target, water in the dermis.
So what does that mean in terms of how we use it?
Well, because it's so good at absorbing water, we have to use a cooling agent on the epidermis, the top layer of the skin, to prevent any blistering.
So a bit more aggressive than the 1064 N.YAG.
Yes, but still non-ablative. Important to set realistic expectations, though. The results are still less dramatic than with ablative lasers.
Got it. Now let's talk about post-treatment care. This is so important to prevent complications, especially after those more aggressive treatments. What are the key things residents need to know?
Moist wound healing, that's number one. We usually prescribe antivirals like valacyclovir or acyclovir to prevent those herpes simplex flare-ups, and antibiotics like cephalexin to keep infections at bay.
What about antifungals?
Sometimes we'll use fluconazole. A short course of steroids can also help reduce inflammation and swelling.
And topically, what do we use?
Topical vitamin C, 10%, that's a good one. Antioxidant helps boost collagen. And then just simple lipid-based ointments to keep everything moist and help it heal.
Anything we should avoid putting on the skin.
Yeah, we generally stay away from topical growth factors. They can actually increase the risk of hypertrophic scarring, and nobody wants that.
Good to know. And what about preventing hyperpigmentation, those dark spots?
Hydroquinone, kojic acid, and of course, sunscreen, sunscreen, sunscreen. Can't emphasize that enough.
All right, let's talk about intense pulsed light, or IPL. It often gets lumped in with lasers, but it's a different beast altogether.
It is. IPL, it's not actually a laser. It uses a broad spectrum of light wavelengths, not a single focused wavelength like a laser.
So how is it different in terms of what it targets?
IPL can go after multiple chromophores at the same time, mostly water, hemoglobin, and different types of melanin.
And what do we use it for?
IPL, it's great for those blood vessel problems, things like flushing, telangiectasias, rosacea. Also good for hyperpigmentation, like sunspots, melasma, freckles. And some people use it to improve skin texture and pore size.
Sounds pretty versatile. Any contraindications? When would we not use ITL?
If the patient has unrealistic expectations, we have to have that conversation. If their skin's tanned, if they're sensitive to sunlight, or if they're taking medications that make them sensitive to light, IPL is a no-go.
And more specific contraindications.
Active treatment with isotretinoin. If they're on blood thinners, pregnant, have active lupus, history of problems with wound healing, skin cancer, or if they're Fitzpatrick skin type, a VI, the darkest skin type, those are all contraindications.
Got it. And side effects. What do we need to watch out for?
Redness that hangs around too long, little spots of pigment changes, scabbing, swelling, hair loss, purpura, hyperpigmentation, hypopigmentation, herpes outbreaks, infection, and scarring.
So we have to be careful with this one. How many treatments do patients typically need, and how far apart?
Usually a series of 4 to 7 treatments spaced about 2 to 3 weeks apart.
And realistically, how much improvement can patients expect to see?
We have to be realistic. IPL can improve facial flushing or rosacea by about 50 to 75%, and dyschromia, those pigment problems, by about 40 to 60%. It's not a miracle cure.
Right. Setting those expectations is key. What about pre- and post-treatment care? Anything special we need to do?
Not much prep needed before IPL, but no tanning beforehand. After treatment, they'll have some redness and swelling for about a day. And of course, sunscreen is a must every day.
All right, that was a great overview of lasers and IPL for facial rejuvenation. So much to consider when choosing the right treatment for each patient.
Definitely. We covered a lot, but this is really just the foundation.
Absolutely. Always more to learn in this field. It's always changing.
Now let's move on to laser safety. It's paramount. What are the absolute must-knows when it comes to using lasers for facial rejuvenation?
Laser safety, yeah, it's not something to mess around with. What are the non-negotiables?
First and foremost, eye protection for everyone in that room, the patient, the doctor, anyone else. And those goggles, they have to be specific for the wavelength of the laser we're using.
So those goggles, they're not just for show. They're there to protect everyone's vision.
Exactly. And fire hazards. We always have to be mindful of fire hazards. Lasers can easily ignite things like grapes or those alcohol-based skin preps. Make sure the treatment area is clear of anything flammable, and have a fire extinguisher close by, just in case.
Safety first. Now, patient selection. Not every patient is a good candidate for laser treatment. What are some of the things residents should be thinking about when evaluating a patient for a laser facial rejuvenation?
Patient selection, it's critical. We need to look at their skin type, their medical history, their lifestyle, and their expectations. All those things factor in.
Okay, let's break that down. Skin characteristics.
Yeah.
What are we looking at specifically?
Skin tone, texture, laxity. If someone has fine wrinkles and a little sun damage, maybe a non-ablative laser is a good choice. But deeper wrinkles, acne scars, a lot of sun damage might need something more aggressive, like an ablative laser.
And skin type, how does that play in?
Skin type, we use the Fitzpatrick scale. Lighter skin types, I3, they usually tolerate lasers well. Darker skin, IV6, much higher risk of pigmentation problems, so we have to be more conservative.
So tailoring the treatment to the individual's skin is key. What about their medical history? Any conditions that would be a red flag for laser treatment?
Active skin infections, certain autoimmune diseases, history of keloid scarring, those are all things we have to consider. Might not be good candidates.
And medications. Any medications that could interact with the laser or increase the risk of complications?
Absolutely. Some medications can make the skin more sensitive to light. Isotretinoin, for example, that's a big one. Always review the patient's medication list before doing anything with a laser.
You mentioned lifestyle earlier. How does that come into play?
Lifestyle can make a big difference. Smokers, for example, they often have problems with wound healing, so that could affect their recovery after a laser treatment. And people who spend a lot of time in the sun, they need to be really diligent about sun protection.
You also talked about the importance of managing patient expectations. Why is that so important with laser facial rejuvenation?
Laser treatments, they can do amazing things, but they're not magic. It's crucial to be honest with patients about what they can expect. We need to set realistic goals and make sure they understand that multiple treatments are usually needed to get the best results.
It's not a one-and-done thing. And it's important to emphasize that laser treatments can improve the signs of aging, but they can't stop the aging process. We all keep aging.
Exactly. And patients need to understand the potential risks and complications. Informed consent is essential.
Now let's talk about the technical aspects of performing these laser treatments. What are some of the key technical considerations that residents need to be aware of when using lasers for facial rejuvenation?
We're talking about how we deliver that laser energy. There are a few key things to consider: wavelength, pulse duration, fluence, spot size. Each of these variables plays a role in achieving the desired outcome safely and effectively.
Okay, let's break those down one by one. Starting with wavelength, why is it so important to choose the right wavelength for the specific skin issue we're trying to address?
The wavelength determines what the laser targets, those chromophores we talked about earlier. Each chromophore absorbs light best at a specific wavelength. So if we're treating blood vessels, we choose a laser that targets hemoglobin.
Okay, so we've got the right wavelength. What other parameters do we need to think about?
Pulse duration, fluence, and spot size. We need to fine-tune those to get the best results for each patient.
Let's start with pulse duration. What is pulse duration and why does it matter?
Pulse duration is how long the laser energy is in contact with the skin. Shorter pulses, we use those for smaller targets, like tiny blood vessels or pigment cells. Longer pulses are better for larger areas or deeper structures, like collagen.
So we're matching the pulse duration to the size and depth of what we're treating.
Exactly. Now, fluence. This is one that a lot of residents get tripped up on. Fluence is the laser's energy density, how much energy is being delivered to a specific area of skin.
Okay, so higher fluence means more energy.
Yes, and that can mean more dramatic results. But higher fluence also means a higher risk of side effects.
So it's about finding that balance between effectiveness and safety.
Exactly. And the last parameter, spot size. This refers to the diameter of the laser beam. Larger spot sizes deliver energy over a wider area, which can be good for treating large areas quickly. But smaller spot sizes let us be more precise, which is important when we're targeting specific lesions.
So it's all about choosing the right tool for the job.
Exactly.
All right, this has been an incredibly informative discussion on lasers for facial rejuvenation. We've covered a lot, from the basic science to patient selection, laser safety, and those technical aspects of treatment.
We've only scratched the surface. Lasers in aesthetic medicine are a constantly evolving field.
It's an exciting time to be in this field. But before we get ahead of ourselves, let's recap some of the key takeaways from our discussion today. What are the most important things for residents to remember when using lasers for facial rejuvenation?
First and foremost, you have to understand the basics of how lasers work. The interaction of light with tissue, selective photothermolysis, the different types of lasers available.
You can't just know which buttons to push. You need to understand the why behind the what.
Exactly. Then you can move on to patient selection, laser safety, and treatment protocols. Remember, every patient is different, so you have to tailor the treatment plan to their individual needs and goals.
Personalized medicine, finding the right laser and the right settings for each patient. What about those technical considerations? What are the key takeaways when choosing laser parameters?
It's about matching those parameters to the specific issue you're treating. Think about the target, the depth, and the desired outcome. Always prioritize safety. Start conservatively and gradually increase the energy as needed.
It's always better to be safe than sorry, especially when we're dealing with lasers. Now, post-treatment care. What are the essentials?
Post-treatment care is crucial. Emphasize gentle cleansing, sun protection, and avoiding anything that could irritate the skin.
And what about medications? Anything specific we routinely prescribe after laser treatments?
It depends on the procedure and the patient, but we commonly use antivirals, antibiotics, and sometimes topical steroids.
Comprehensive care, both immediate and long-term.
Exactly.
This has been a truly comprehensive deep dive into lasers in facial rejuvenation.
Remember, this is just the beginning. The best way to become an expert is to keep learning, keep practicing, and stay up to date on the latest advancements.
Wise words. And with that, we'll wrap up this part of our laser deep dive.
Now that we've got those laser fundamentals down, let's shift gears a bit and talk about intense pulsed light, or IPL. It often gets lumped in with lasers, but there are some key differences.
Yeah, it's easy to get them confused, so let's clear that up. What exactly is IPL, and how does it differ from an actual laser?
IPL uses a broad spectrum of light wavelength, usually somewhere between 500 and 1200 nanometers, whereas lasers, they emit just a single, very focused wavelength of light.
So less of a precise beam, more like a really bright flash of light?
That's a good way to put it. And because of that broad spectrum, IPL can target multiple chromophores all at the same time.
Sounds pretty versatile.
Mm.
What are the main things IPL targets, and what kind of skin issues can we use it for?
IPL is really good at targeting water, hemoglobin, and different forms of melanin. That means we can use it for things like those vascular lesions, telangiectasias, rosacea, even pigmentation problems like sunspots, melasma, freckles.
So redness and brown spots, two of the most common things patients come in for. How does IPL actually break down those chromophores?
So the light energy from IPL is absorbed by those specific targets, causes them to heat up and break down. We call this selective photothermolysis. For vascular lesions, that heat makes the blood vessels collapse, so they eventually fade away. And for pigmentation, the heat targets and destroys the extra melanin, evening out the skin tone.
It's like a controlled injury, harnessing the skin's own healing power to get rid of those imperfections.
Mm.
Now, IPL is generally safe. But what about risks and side effects? What do we need to keep in mind?
Most side effects are pretty mild and temporary. Patients might have some redness, some swelling, maybe a little sunburn-like feeling.
And how long does that usually last?
It usually goes away pretty quickly, within a few hours or maybe a day or two.
What about those more serious complications? Could those happen with IPL?
Blistering, scarring, changes in pigmentation, they're rare, but they can happen. That's why it's so important to really evaluate the patient before treatment. Skin type, medical history,
Yeah.
any medications they're on, got to consider all of that to minimize those risks.
Right, it always comes back to individualizing that treatment plan. Okay, let's talk about laser safety in general. What are some of the most important safety tips that you make sure all residents know when they're working with lasers?
Laser safety is absolutely essential. Everyone in the room during laser treatment, the patient, the doctor, any assistants, everyone needs to be wearing the right eye protection.
Those goggles, they're not just for looks, they're there for a reason.
Exactly. Those lasers are powerful. They can really damage the eyes if you're not careful. And it's not just about protecting the eyes. We also have to be careful about fire hazards. Remember, those laser beams can set flammable things on fire, so we need to make sure the treatment area is completely clear of anything that could catch fire.
Good point. Always better to be safe than sorry. Always have a fire extinguisher nearby.
Yeah.
Speaking of being careful, let's talk about patient selection again. You mentioned it earlier, but it's worth emphasizing. How do we decide if someone's a good candidate for a laser treatment or not?
Patient selection is so important. We need to think about their skin type, their medical history, their lifestyle, and really importantly, their expectations. Let's start with skin type.
Okay, how does a patient's skin type affect what we do?
Skin type, we use the Fitzpatrick scale, right? That's a big one when we're choosing a laser and deciding on settings. Lighter skin, Fitzpatrick types, I type 3, they usually do really well with lasers. But those darker skin types, IVVC, they're more likely to have pigmentation problems afterwards, so we have to be extra careful with them.
So darker skin tones might need lower energy settings or a different type of laser altogether.
Exactly. Now, medical history. Are there any conditions that would make us say, nope, lasers aren't a good idea for this patient?
What are some red flags? What should we be looking for?
Active skin infections, any kind of those, that's a no-go. Certain autoimmune disorders, a history of keloid scarring, those are all things we need to consider. They might not be the best candidates for laser treatments.
What about medications? Are there any medications that could cause problems with laser treatment?
Oh yeah, definitely. Some medications make the skin more sensitive to light. Isotretinoin, that's a common one. We have to look carefully at the patient's medication list before we do any laser treatment.
It's like being a detective. We got to get all the information before we decide what to do. You also mentioned lifestyle. How does that come into play?
Lifestyle can be a big factor. Smokers, for example, their wounds don't heal as well, so they might not be the best candidates for some laser procedures, especially ablative lasers. And then those who spend a lot of time in the sun without good sun protection, they might not get the results they're hoping for, or they could even have complications.
So talking to patients about sun protection, that's a must before and after treatment.
Absolutely. Sun protection is key. It's important for those results to last and to prevent problems. Speaking of expectations, you mentioned that earlier. Why is it so important to manage patient expectations when it comes to lasers for the face? Lasers are great, they can do amazing things, but they're not miracles. We need to be upfront with our patients, tell them what lasers can realistically do and what they can't. It's about setting realistic expectations and making sure they understand that it often takes multiple treatments to get the best results.
So it's not a one-time fix. We have to make sure our patients understand that. What else should we be talking to them about?
Risks and complications. We've got to be honest about those. We want our patients to be informed, to be able to make the best decisions for themselves. Informed consent, that's crucial.
Transparency and open communication, that's how you build trust with patients. Okay, let's switch gears a bit and talk about the technical side of doing these laser treatments. What are some of the key things residents need to know about the technical aspects of using lasers for facial rejuvenation?
We're essentially fine-tuning how we deliver that laser energy to the skin. We adjust different parameters: wavelength, pulse duration, fluence, and spot size. These are all important for getting the results we want safely and effectively.
Let's break those down one by one. Starting with wavelength. Why is it so important to pick the right wavelength?
The wavelength, that determines what the laser targets, those chromophores we talked about. Each chromophore has a specific wavelength that it absorbs best. So for example, if we're treating those vascular lesions, we want a laser that's really good at targeting hemoglobin.
It's like finding the right key to unlock the door, the right wavelength to address the specific problem.
Exactly. Once we have the right wavelength, then we adjust those other parameters: the pulse duration, the fluence, and the spot size. That's how we fine-tune the treatment for each patient.
Okay, let's talk about pulse duration. What is it and why does it matter?
Pulse duration, that's how long the laser energy is actually touching the skin. Shorter pulses, we use those for smaller targets, like little blood vessels or pigment cells. Longer pulses, those are better for treating bigger areas or things that are deeper down, like collagen.
So it's about matching the pulse duration to the size and depth of what we're treating.
Exactly. Now, fluence. This one can be a bit tricky. Fluence is how much energy the laser is delivering to a specific area of skin. We measure it in joules per square centimeter.
So higher fluence means more energy.
That's right. More energy can mean better results, but it also means a higher risk of side effects.
So we need to find that sweet spot, the right balance between getting good results and keeping things safe.
Exactly. Now, the last one, spot size. This one refers to the diameter of the laser beam, how big the area is that the laser is hitting.
Okay, and why is that important?
Larger spot sizes, those deliver energy over a wider area, so they can be good for treating large areas quickly. But if we want to be more precise, like when we're targeting specific lesions, we need a smaller spot size.
So it's like choosing the right paintbrush. A big one for broad strokes, a small one for detail work.
That's a great analogy. We need to use the right tool for the job, the right spot size for the specific area, and what we're trying to achieve.
Okay, so we've covered a lot today. From the basics of lasers and IPL to safety, patient selection, and all those technical details. That's a lot of information.
It is, but these are the fundamentals. Any resident working with lasers needs to understand these concepts. The best way to get really good at this is to keep learning, keep practicing, and stay on top of the new things that are happening in laser technology.
Great advice. And before we move on, let's talk about taking care of patients after laser treatment. What are the key things we need to tell our patients to do to avoid complications and get the best results?
Post-treatment care, it's super important. We have to stress to our patients that they need to be gentle with their skin. Cleanse gently with a mild cleanser and lukewarm water, no harsh scrubs or anything like that. And sun protection, that's crucial. They need to wear sunscreen every single day, SPF 30 or higher, even on cloudy days.
Are there any specific products or treatments they should avoid after a laser procedure?
We usually tell them to avoid anything that could irritate their skin. Things like retinoids, alpha hydroxy acids, those are big no-nos. And we want them to avoid any other facial treatments that could traumatize the skin, like chemical peels or microdermabrasion, until they're fully healed.
Okay, so gentle cleansing, lots of sunscreen, and avoiding anything that could irritate the skin. That makes sense.
Exactly. And depending on the procedure and the patient, we may also prescribe some medications to help with healing and prevent complications.
What are some of the usual suspects, the medications we often prescribe after laser treatments?
We often prescribe antiviral medications like valacyclovir or Playplover, especially after ablative procedures, to prevent cold sores. Antibiotics like cephalexin can help prevent infection. And sometimes we use a short course of topical steroids to reduce inflammation and swelling.
So it's about being proactive, anticipating those potential problems, and taking steps to prevent them. What else should residents be thinking about when taking care of patients after laser treatments?
Follow-up appointments, those are key. We need to monitor how they're healing, address any concerns they might have. That way, if any complications do come up, we can catch them early and adjust the treatment plan if we need to. And we always tell patients, if you see anything unusual, anything that worries you, or if you have any questions, call us right away.
Communication is key. Okay, this has been a really in-depth look at lasers and facial rejuvenation. I think our listeners will come away from this feeling a lot more confident in their knowledge of this area.
I hope so. But remember, this is a complex field and it's changing all the time. The best way to stay on top of it is to stay curious, keep learning, and always be on the lookout for new information.
Great advice. Now let's move on to the final part of our deep dive, where we'll look at some real-life cases and how these laser technologies are actually used in practice.
Okay, so let's get into some real-life scenarios and see how all of these laser technologies we've been talking about actually translate to the clinic. Imagine you have a 45-year-old woman, Fitzpatrick skin type 3. She's coming in. She's concerned about fine lines around her eyes and mouth and some sunspots on her cheeks.
Okay, classic presentation. What's our game plan for her? What would be a good first-line approach in a case like this?
Well, first, I want to hear her thoughts. What are her goals? What kind of downtime can she handle?
Okay, good point. Let's say she's looking for noticeable improvement, but doesn't want to be out of commission for weeks.
In that case, I might suggest a series of non-ablative fractional resurfacing treatments.
Makes sense. Why fractional resurfacing specifically?
It targets both those fine lines and the sunspots. Plus, it has minimal downtime, usually just a day or two of redness and swelling. We could also consider IPL for those sunspots.
Okay, good options. Now, let's say we have a different patient, maybe a 60-year-old man, Fitzpatrick skin type 2. He's got deeper wrinkles, some acne scarring, and more significant sun damage.
This gentleman is probably going to need something a bit more aggressive.
Right, non-ablative might not cut it for him. What would you recommend in this case?
We could consider a CO2 laser resurfacing procedure.
Okay, CO2, that's our workhorse for more significant rejuvenation. What are the key considerations with CO2 resurfacing?
We need to be mindful of the potential for hypopigmentation, especially with fairer skin types. And the downtime is longer, usually about a week or two of redness, swelling, and peeling.
And this is where those meticulous post-treatment care instructions really come into play.
Absolutely. We need to make sure those patients are well informed and prepared for the healing process. Now, what if we have a patient with a lot of redness, maybe some visible blood vessels, telangiectasias on the face?
Okay, so more of a vascular concern. What are our go-to treatments for that?
For those dilated blood vessels, we've got a few good options. We could use a pulsed dye laser or PDL.
How does PDL work, and what are its advantages?
PDL emits a wavelength of light that's specifically absorbed by hemoglobin in the blood vessels. That heat causes the vessels to collapse, and over time they fade away. It's a great treatment for those superficial blood vessels, and it has minimal downtime.
So quick recovery, that's always a plus. Are there any other laser options for vascular lesions?
Another option would be the ND.YAG, a 1064 millimeter laser. Remember, it's non-specific, so it targets both blood vessels and water.
Okay, so it's a bit less targeted than the PDL, but can still be effective for vascular concerns?
Exactly, and it's safe for all skin types, which is a big advantage. Now, let's say we have a patient with melasma, those stubborn patches of hyperpigmentation.
Melasma, that can be a tough one to treat. What are our best laser options for tackling melasma?
Melasma is tricky. We have to be very careful because lasers can sometimes make melasma worse. But if we choose the right laser and use very conservative settings, we can sometimes get good results.
What would be a good laser choice for melasma?
A very low-fluence Q-switched ND-YAG 164 millimeter laser can be effective for some types of melasma.
And what's the key to success with laser treatment for melasma?
Patience. It often takes multiple treatments, sometimes even a dozen or more, to see significant improvement. And we have to emphasize to patients that melasma can recur even after successful treatment.
So diligent sun protection is crucial.
Absolutely. Sun protection is non-negotiable for anyone with melasma.
All right, we've covered a lot of ground today. I think we've given residents a good taste of how these various laser and light-based technologies can be used in real-life scenarios. We've talked about the science behind how lasers work, the different types of lasers available, and the importance of careful patient selection, safety, and post-treatment care. We've even touched on some of the more challenging conditions, like melasma. But, as you said earlier, this is just the beginning.
It is. The world of lasers and aesthetic medicine is vast and constantly evolving. There's always something new to learn, a new technique to master, a new technology on the horizon. I encourage all residents to embrace this challenge, stay curious, and never stop learning. The future of this field is incredibly exciting.
Well said. And that brings us to the end of our deep dive into lasers for facial rejuvenation. We hope you found it informative and, dare we say, illuminating. Until next time, keep those lasers firing safely and effectively.